Hey everybody, it's Dr. Randy with Kelstein Family Chiropractic. Today I have Paul in the office. Paul's been a patient for years. Comes in for tune-ups, every now and again. But he came back in about a week ago, right, Paul?
Yeah.
About a week ago with a right SI sprain. What'd you do again? You don't know how you did it?
No.
Basically, so insidious onset. No trauma, nothing like that. So. Your SI joint is, if you want to get here, Ash, is basically this joint where your sacrum, which is this triangular bone, down here at the base of your lumbar spine, and then we have these two iliums on the left and right side. And when you walk, the two iliums go in from extension to flexion, kind of like this. Those iliums and that SI joint can become restricted, and that basically is what happened to him. And then inflammation builds up and scar tissue builds up, and the nerves that exit there become irritated and was giving him radiating pain into his hip and even some into his low back. So we're going to adjust that today. But before his adjustment, he's on this flexion distraction table. So we're going to demonstrate that. This is a really good tool we have in the office for low back pain, for hip pain, for sciatica, and for these SI sprains that are so common in the office. So what this table does is I can kind of pin him with one hand and then extend the table with the other and even get some rotation and really get a good stretch into those muscles, into those joints. So when you sit, Paul's going to truck a lot all day at work, or when you sit a lot, even if you're at a desk, which so many people do, that sort of compresses the spine. The 33 bones of the spine, especially the lumbar part, become compressed when you're sitting all day. So a table like this is really nice because it stretches those vertebrae back out, stretches the space in between your vertebrae, that intervertebral disc we call it. It allows some more blood and oxygen to get back into that disc. So there's a nice traction technique for him. So you could probably stand back out there again. Remember, this is all can be edited. It's like right on my face.
We should watch some bloopers.
Yeah, I'll have to have him send them to us when he does it. That's just Paul?
Mm-hmm.
So we got a good release. So just doing that stretch actually distracted his L2, L3 vertebrae. We thought a nice good release, which is excellent. Okay, so we're going to stop this. I'm going to lock it. And we're going to get him adjusted. So in this office, I do a lot of drop table work. Very effective adjustment for the low back, for the lumbar spine, for the hips. So you hear this table lift up and drop down as I'm pressing on certain parts of his hips and his pelvis. Good. All right, Paul, take a nice deep breath in for me. Exhale, blow it all the way out. Lift your head up. Good. You can relax it. Very good. Deep breath in again. Exhale. Good. A lot of times we'll get into this, what's called his piriformis muscle and his glute med muscle. Also where his lumbar QL muscle attaches, and just kind of with our forearm. How's that, Paul? Tender? Not really?
Yeah, I'm feeling a lot better than I was.
So he's doing a lot better. It's his third or fourth visit since he did this, so he's really responding a lot better. So that was a lot more tender when he first started. Now that's getting better. Tender here at all?
Yeah, a little bit.
Good. Go this side up for me. Just this low back this way. Paul's got to do. Let's bring this arm all the way through that. So just relax your upper body. Take a nice deep breath in for me, Paul. Exhale. Good. There it is. Other side. Okay, deep breath in, Paul. All the way out. Good. Face up for me. Hang on to the sides of the table this way. Maybe give his leg a little pull, a little distraction for his hip. Relax your leg and knee, Paul. And this one. Good. Cross your arms. Slide down towards your feet. Roll back on my hand. One more. And last one. Okay. So far, so good. Come on back towards me a little bit. Okay. Just relax your shoulders. And up top on this side. Good. And let's do your shoulders. You can sit up for me. Switch your feet over. Relax this arm for me, Paul. This arm. Relax your shoulders.
Probably both popped actually.
Yeah, did good today. All right. So you feeling better so far?
Yeah,
All right. That's Paul's adjustment.
definitely a lot better than I was before.
Excellent. So we like to hear. All right. Thanks for watching.